Good evening, everyone. Good evening, good evening. You're welcome to today. Today is the most anticipated day in the whole month. Yeah, today is cervical cancer webinar. What every woman should know. Not only what every woman should know. Every man, every lady, every girl should know about cervical cancer. And this is proudly brought to you by its favorite nurse, and we're so glad to have you this evening. So, without wasting much time, I am Badake Roda Motsorayo, lead team favorite nurse. I'm a registered nurse, registered midwife, registered public health nurse, and I hold a bachelor degree in nursing science. Today, joining me today, we have Nurse Akani Jesu Tomi. She is a She's a registered nurse, a registered midwife who earned a Bachelor of Nursing Science degree from the University of Ilorin. She is a registered public health nurse with special interest in sexual and reproductive health. She is currently interning at the Obafemi Awolowo University Teaching Hospital Complex, where she delivers patient-centered care while honing her clinical skills. Beyond her clinical practice, Nurse Akoni shares her reflections and messy attempts at being human through her personal blog. She also explores her creativity with the paintbrush and shares her beaded craft with the world through her business, Frankie's Bead Shop. So I present to you Nurse Akoni Jesu. Hey, Jesu, I'm always mixing this name up, but I present to you Nurse Akoni. Good evening, Nurse Akoli. It's an honor to invite you here on stage. Please, if
Good
you are
evening.
online, let us welcome Tommy. This is Tommy. Yeah, let's welcome Nurse Josie Tommy via the comment section. Okay, you have the floor, ma.
Good evening, everyone. As earlier mentioned, Nurse Akoni, Elizabeth Tomilayo. I am a registered nurse, midwife, and public health nurse, and I earned my Bachelor of Nursing Science degree from University of Ilorin in Kwara State. So I'm really thankful for the opportunity to speak on this topic this evening, and I'm thankful for the organizers as well. Thank you very much. So I think we can start the discussion now. The topic I'll be presenting is on cervical cancer, what every woman should know. Um, Ms. Badakin, can I have the slides? All right. So cervical cancer, what every woman should know. I would try my absolute best um, to make my information accessible to everyone. So I will try to minimize medical jargon so that everybody can understand what I'm talking about. So if at any
Medical
point
jargon.
you want to ask questions or you
Please, can you speak up a bit? It is not really clear on my end. It's kind of low. The voice kind of low.
wait, is this better? Is
Better,
this better?
better.
All right. So I said I will try my best to make the information accessible. So if at any point you feel like I'm already becoming too technical, please like let me know in the comments so I can adjust. So please next slide please.
Okay.
So this is the outline of what will be discussed this evening. I'll try to be straight to the point but also like discuss it properly so that everybody can follow what I'm saying. So next slide, let's start with the introduction. Let's begin. All right. So what is cervical cancer? Cervical cancer is just the abnormal growth of cells that starts in the cervix. That's what it is. It's just when there is an abnormal growth of cells and it starts in the cervix. That's the simple explanation. There's nothing to it. But What's when we talk about cervical cancer, cancer of the cervix, like where's the cervix? Because I find that a lot of women and girls don't know a ton about their own reproductive system. So, like, let's even start from there. What is the cervix? So, the cervix is the lower end of the womb that connects the womb to the vagina. So, the vagina is the external portion of the female reproductive system, and opens out to the vulva, and then connects to the womb up. So, the passage in between the vagina and the womb is the cervix. And what does it do? It produces cervical mucus. So during ovulation, about 14 days after the beginning of your period, you can notice that like there is a slimy substance on your underwear. So that's the cervical mucus, and what that does is to aid the transport of sperm after during intercourse from the vagina to the uterus. So that's one of the functions of the cervix. Another thing that it does is that it opens up during labor to allow the birth of the fetus. So whenever it says that you're watching a movie or someone is in labor and they say, oh, she's 6 cm, she's 8 cm, they're talking about the extent of the dilatation of the cervix. They're talking about the extent to which the cervix has opened up. So while in labor, the cervix opens up to allow the birth of the fetus, but normally it is closed and it protects the upper reproductive system from like infection and all of that. Then also allows passage of blood from the uterus to the vagina to the so outside the body. So those are some of the things that the cervix does. So now we know where it is. It is between the vagina and the uterus, the womb. So how does it feel? Where can it be found? So if a clean finger is inserted into the vagina, at the end of that canal, you feel something that feels like the tip of your nose. That's what is described as. It feels like the tip of your nose. It feels like a circle with a dimple in between. So if you're someone that has not had any vaginal deliveries, it is a dot, like you just feel like a dimple in the middle. But if you've had a vaginal delivery, to be a slit. So that is what it feels like if you want, if you're curious and you want to check it out. So that's now that everybody is on the same page about what cervix is and what cervical cancer is. Let's move on to the next slide. Okay, so why should I care? Why should I care about this topic today? What's so special about it? Why should I pay attention? So cervical cancer is the second most frequent cancer among women in Nigeria, according to the World Health Organization in 2023. So it is second to breast cancer. It is the second most frequent cancer among women in Nigeria, and it causes the second most frequent cancer. It causes the second most frequent cancer death among women between 15 and 44 years of age. So it's a very prevalent disease. And the extra reason why we should be concerned and why we should pay attention to cervical cancer is that it is very preventable. It is preventable. It's not one of the cancers that you can say, oh, what could I have done? There's nothing I could have done. It just happened. This one, you can prevent it, and it is treatable, it is curable if it is detected early and if it is managed early. So there's no reason why someone should come down with this disease for something that is so dangerous, but it is preventable and treatable with early management. There's really no reason why we should come down with this, which is why we should pay attention and we should equip ourselves with proper information. Next slide, please. So, what is the cause of cervical cancer? What causes it is a virus. The virus is called human papilloma virus, and as with viruses in general, there are several types of strains of the virus, and HPV has a ton of strains, but the strains that cause cancer the most are the strains 16 and 18. These two strains cause 70% of all cancers. These are not the only two strains that cause cervical cancer. The strains of HPV are divided into, they're categorized based on the risk of causing cancer into low, intermediate, and high risk. So these 16 and 18 and a few others are the ones in the high risk group, but 16 and 18 cause 70% of all cases. So those are like the major ones that we are concerned about. So how does one get in contact with the virus? How is it transmitted? The virus is transmitted through sexual contact. So it's a sexually transmitted infection, it's a sexually transmitted disease. So this sexual contact does not only include penetration, it's not until there's penetration, it can be transmitted through oral sexual contact, vaginal sexual contact, anal sexual contact. So we'll be talking about this later, but like because of the like it's skin to skin, intimate contact that transmits this disease. So even the use of condoms is not like an 100% way of preventing this disease. Because even if you are using condoms, there are parts of your genitals that will still touch, and so those things can still expose one to getting the virus. So that's how it transmits from one person to another. And the way it is that it is such a common thing, such that I think about 80% of people that are sexually active would get infected with HPV at some point in their life. This is nothing that you can do about it. It is just that common. HPV infection is so common that if you are sexually active, chances are that you'll get infected at some point in your life. That's just the way it is. But not all these infections are going to lead to cancer. So just because you've been exposed to something you lead to cancer. Now I mentioned earlier that there are several strains of the virus, and some strains are low risk, some are intermediate risk, some are high risk. So when someone gets infected with this HPV virus, which is very common, a lot of times the body fights against it and it goes away on its own without issues, no symptoms, does not develop into cancer, right? But sometimes this infection persists. So cervical cancer is caused by persistent HPV infection. So when it persists for years, it will lead to changes in the cells in the cervix. And these changes will cause what is called a precancerous lesion. Now, if this lesion is not detected and managed early, that's what will lead to cancer. So that's like the cause of the disease, and that's how the disease progresses. Infection, almost everybody get infected, but most people will fight, the immune system will fight it, it will go away. But those people that it doesn't go away, it will form the cancerous lesions. And if those lesions are not treated, it will form the cancer. So that's what causes the disease. Please, the next slide. Next slide, please. Okay, so that's the cause of the disease. That's what causes it. But there are also certain factors that would predispose one to even getting infected. So some of these factors include having multiple sexual partners, early age of first sexual activity. That's to say, if somebody loses their virginity early in life, like maybe in the early teens, before some people say before 16, some people say before 18, early age of first sexual activity, having many children, like grand multiparity, having many children, use of birth control pills, use of oral contraceptives have also been associated with increased risk of weakened immune system occur in people that are living with HIV. These people, their immune system is compromised. People that use cancer medication, such people that are on chemotherapy, people that use transplant drugs. So people that are having maybe kidney transplant, whatever transplant, they are prescribed medication that are designed to reduce their immune response so that their body does not fight against the foreign organ that they are transplanting. So those type of people are at increased risk of developing cervical cancer. And then smoking, whether you're the one smoking or whether you're just breathing in secondhand smoke, that's also a risk factor to developing cervical cancer. So these are not the things that cause it. These are just the things that increase your risk or predispose you to developing um, cervical cancer. So please, next slide. All right, so let's discuss the signs and symptoms. So one thing about cervical cancer is or HPV infection in general is that it is often asymptomatic. A lot of times it does not present symptoms at all. But the times that it presents symptoms, the symptoms can look like this. So at the early stage of the disease, during the infection with cancerous lesions, some of the things that a person might notice would include things like vaginal bleeding after sex. So when a person has sex and then afterwards they are bleeding, then another one that can happen is vaginal bleeding after menopause. So someone that has achieved menopause that is no longer having periods suddenly starts seeing blood again. And person just thinks, oh, maybe it has come back. It does not come back is a warning sign, and someone such a person should seek professional help. So another thing is bleeding between periods or heavier or longer periods, vaginal discharge that is watery or has a foul odor or contains blood, pain during sex, and pelvic pain. So the thing about these signs and symptoms is that they are not specific to cervical cancer. Like a lot of people have irregular periods, long periods, and that does not mean that they have cervical cancer. It's just a warning sign. So if someone should see any of these things, it is important that it is important that they seek professional help. But again, it's not as if, oh, once you see this thing, it means you have cervical cancer. So as the disease progresses, some of the late signs and symptoms that one may see may include painful bowel movements, then bleeding when you go to the toilet, bleeding when you urinate, painful urination, swelling of the legs, abdominal pain, backache, and fatigue. So again, these things are not specific to cervical cancer. It doesn't mean that if you have backache now you have cervical cancer. No. But it just means that if you identify some of these signs and symptoms, it's important that you seek professional help so they can run tests and you know know what's going on. So as I said, it is usually asymptomatic, but these are some of the signs and symptoms that would alarm you and say, okay, let me seek help. Please next slide. I hope I'm not too fast because I'm almost done with my slides. I want to check the comments. Okay.
I guess that's a network issue. Our speaker just left the call. Please give us a minute to quickly fix that technical issue. Thank you.
Yeah, I'm sorry, I got disconnected. So, I'm on prevention now. So, what are the ways that we prevent cervical cancer? From a public health approach, there are three stages of prevention: the primary prevention, secondary, and tertiary. So, the primary prevention are the things that we do to prevent exposure to the disease at all. We don't even want it to happen. We don't want it to infection to even start. We don't want it at all. That's primary prevention. And some of these things include risk factor modification. So please can we go back to the slide on risk factors? Okay, thank you. So risk factor modification means that what are the things that I can do as an individual to reduce my risk of developing the disease? So that's risk factor modification. So for example, thing of multiple sexual partners, that is a very modifiable risk factor. That's something that you can change by yourself. So it's important to stay with one partner, be faithful to your partner. Then early stage of first sexual activity. Well, for this one, if you are already sexually active, this one is not modifiable. But if you are not, or if you have young girls around you, it's important to educate them to delay the age of first sexual activity. Then having many children, this is also very modifiable. Grand multiparity, having many children, there is no good, yeah, like talking from a healthcare perspective, there are no benefits. They are just like consequences, they're just risk. risks involved in having many children. So, and this increased risk of cervical cancer is just one. You're risking your life, you're risking your health, you're risking your womb, and all of that. So, this is also a very modifiable risk factor. You can decide to use birth control, contraceptives. There are a ton of family planning methods that are available that can be used to modify this risk factor. Then, use of birth control pills. This has been associated with the risk of cervical cancer. But when it is that you are choosing a method of family planning, there's a risk benefit ratio that you and your healthcare professional will discuss. So when both of you sit down and there's a counseling session to choose a family planning method, you discuss the risk and the benefits. So it's now up to you and your healthcare professional to decide whether the risk is worth it, or if the benefit is worth taking the risk. But if this is something that you're really concerned about, there are tons of different contraceptives that are available and affordable so that you can use if instead of oral contraceptive pills, which are the 1 a day birth control pills. So the weakened immune system, what happens with these people is that it is recommended, we'll speak about it later, but it is recommended that they get screened more often than the general population. And it's also recommended that they take the vaccine. And they even take the vaccine in more doses than the general population. So while we'll talk about this later, but while everybody else is taking either 1 or 2 doses, depending on the schedule in their country, these immunocompromised people will be taking like 3 doses. So can
Yes,
I
tell
go on?
me,
Is there a
please,
problem?
yes, can you please, can you, like, your speaker is going down, your voice is going down.
I'm sorry, is this better?
Yes, it is now.
Alright. So I was saying that the risk factor, the second to last risk factor, weakened immune system. I was saying that the way that we modify this risk factor is that people that are living with HIV and other immunocompromised people, it is recommended that they get screened more often than the general population. We'll discuss this later. So while everybody else, it is recommended that they get screened every 5 years, these people, it is recommended they get screened every 3 years. Then another thing that we do to modify this risk factor is that they take more doses of the vaccine. So I was saying that for the general population, it's recommended depending on the country that you are, right? They give either 1 or 2 doses of the vaccine. But for these immunocompromised people, they give like 3 doses. That's the way that we modify this risk factor in immunocompromised persons. So for smoking is also a very modifiable risk factor. Don't smoke. Don't stay beside people that are smoking. So those are some methods of primary prevention. So let's go back to the slide on prevention, please. Thank you. So another method of primary prevention is counseling. Counseling, education. This is one of those avenues for that, where you're educating the public, you're speaking to people about the disease, how to manage, how to prevent. Then vaccination. We're going to discuss that in detail very soon. So secondary prevention, this is want to prevent the progression of the disease, want to detect it early. So the ways that we do this is by screening. We're also going to discuss screening in detail very soon. So screening will lead to early detection of the disease. So now tertiary prevention is about, how can we prevent complications? How can we prevent it from causing too much problem now that it has happened? So that's tertiary prevention. So the ways that we do this is by treating it early and mitigating the damage. We want to mitigate metastasis, we want to mitigate spread of the cancer. Those are the ways that we prevent it, both primary, secondary, and tertiary. I really hope that um like you're understanding what I'm saying. So please can you move to the next slide? Okay, so now we want to talk about the vaccine properly. So the HPV vaccine is a safe and effective method of preventing cervical cancer. I mentioned earlier that the virus HPV has many different strains or types. So what it is that the vaccine that is available targets the common cancer causing types. Now I said that there are some strains of the virus that the risk of causing cancer is very low. The risk of causing cancer can be intermediate, the risk of causing cancer are high. So the virus will target the high risk strains of the virus, and not just the high risk ones, the common ones, the common high risk ones. So, and it is ideally taken before first sexual contact. I mentioned earlier that like no, like it is almost certain that someone will get infected with HPV during their lifetime if they are sexually active. So this is why it is targeted to people, to girls before first sexual contact. That's why we tell girls to take it like nine 9 to 14 years, when it is assumed that they have not had they are not sexually active. So it's ideally taken before first sexual contact. But it is a preventive method, it's a preventive measure in that it cannot treat the infections that has already happened. There are plenty strains of HPV virus. If someone has already been exposed to a particular strain before someone takes the vaccine is not effective for the strain that you've been exposed to. It's only effective for the future infections for the strains that you have not been exposed to. So I was saying earlier that immunocompromised people take multiple doses of this vaccine. So that's what is shown in the diagram here. So this is an infographic by the WHO. For younger people, 9 to 14 years, we want to give 1 or 2 doses depending on the country, really, depending on the immunization schedule in the country. But if a person has been identified to be immunocompromised, the person will take 2 or 3 doses. So these people, like we said earlier, girls living with HIV/AIDS, people that are on chemo, people that uh, people that are on transplant medication. So now we can move to the next slide. Thank you. Okay, so I compiled a list of frequently asked questions about the vaccine. So things that might not be questions that you might have. I'm anticipating your questions now about the HPV vaccine. So who can take the vaccine, or who should take the vaccine? It is recommended for girls, young girls between the ages of 9 to 14. Again, we want to catch them young. We want to vaccinate girls before their first sexual contact. So it's recommended for girls aged 9 to 14. But catch-up vaccination is available for girls and young women up to age 26 if you were not previously vaccinated. This is not the slide I'm on. I'm on the first slide about the frequently asked questions. Is the previous? Yes, this is where I am. Thank you. Yes, thank you. So, I think we've settled that question. Who should take the vaccine? Ideally, in an ideal situation, 9 to 14. But if you not get it when you're 9 to 14, you can take it up to age 26. So, but no, so I'm already sexually active. I did not know this one before. Can I still take the vaccine? Yes, you can still take the vaccine even if you're sexually active. It is not ideal. The ideal thing is I want to target you before you have been exposed. But if it has happened, it has happened. You can still take the vaccine. So as I said earlier, the vaccine will not protect you from infections that you've been exposed to, from HPV infections or strains that you've been exposed to, but it will protect you from future infections. So the fact that you're sexually active does not mean that you can't take the vaccine. The fact that you're not 14 again does not mean you cannot take the vaccine. I took the vaccine in my 20s. So the next slide now, we can go to the next one. Okay, are there any side effects? I'm on the slide of are there any side effects? Thank you. So are there any side effects? All vaccines have side effects, even for babies. When you give them vaccine like this, throughout that they just know there'll be fever, there can be soreness at that point. So those things are still applicable to HPV vaccine. When you take the vaccine, the site can be sore, can be itchy, those type of small small things. You can have fever. Throughout that day, you can be tired. uh But that extreme side effect, like something that is concerning, those type of side effects are very rare with the vaccine. So how much does it cost in Nigeria to take the vaccine? HPV vaccine is free. It is free in government facilities. This one is the UNICEF website says is free for girls aged 19 to 14. Like I said, I took the vaccine when I was in my 20s and it was still free. I did not pay any money. So you can go to any PHC, primary health care center, and ask to take the vaccine. So we can move to the next slide now. Okay, so what is the vaccine schedule in Nigeria? In Nigeria, it's just one dose. Once you take it, you are taking it. You're not coming back in 3 months. You're not coming back in 6 months. They are done. Once and done. It's taking a single dose. So it's just people that are immunocompromised. If they have like people living with HIV that might have to take multiple doses, as I've earlier explained. So the next question is it safe for people living with HIV? There are some vaccines that immunocompromised people are not encouraged to take, but this vaccine is not part of them. If a person has HIV, does not mean they cannot take it. In fact, it is even more important for people living with HIV to take the vaccine because they're at higher risk of developing it because they are immunocompromised. Their body cannot fight it the way that people that are not immunocompromised can fight it. So it's even more important for people living with HIV to take the vaccine. So these answers, I did not just come up with them. These are the answers that we can move to the next slide now. All right, so the first stage of prevention is the vaccination, which we have discussed. Now, the second part of it is screening. So, screening, whenever we say screening, is that we want to check everybody. We want to check everybody. We want to know. We just want to check. Let's just check. Let's just check in case, just in case. That's what screening is all about. So, screening for cervical cancer. The goal of screening is to find it when we can still do something about it. We want to find precancerous lesions, want to find precancerous cell changes when treatment can still prevent development of full-blown cancer, when it is still treatable, when it is still curable. That's the goal. We want to see that, like we want to catch it young, we want to catch the condition young before it spreads, before it becomes a whole problem. So the frequency of screening, it differs depending on who you ask. But according to WHO, every 5 to 10 years, starting from age 30, then if you are a woman that is living with HIV, you want to start earlier. So you want to start screening from age 25, and then you want to screen every 3 years. So this strategy also includes that the WHO strategy also encourages full lifetime screens by it and a high performance HPV test by age 35 and again by 45 years. So what this means is that, excuse me, what this means is that we want to make sure that by the time you're 35, you have done screening 2 times, right? So, and also we want to make sure that out of those 2 times, you want to do an high performance one. So you want to do it deep, you want to do all the deep tests that you need to do about cervical cancer screening. So as we've said earlier, these precancerous lesions rarely cause symptoms. So you like you might not know. You really might not know. You know, there are some things that happen. Some of these public health conditions, it is screening that catches them. It is screening that catches them. It's the same thing with something like high blood pressure. Like you might not know that anything is happening. You might be having BP of 200, 200, 180. And you say if you don't know that anything is happening, but when somebody does health talk or somebody does outreach and you say, let me to check, and then you check and you see. So it's the same thing. You might not cause symptoms, but when you do your regular screening, that's when you can detect it. So even after vaccination, it is still important. So you cannot say, if I've taken the vaccine, could need jari, why should I still do pap smear? We have already said it before. I've already said it before that the vaccine targets the common cancer causing strains of the vaccine, of the virus rather. So God forbid, what if the strain of the virus that one is exposed to It's an high risk one, but it's an high risk one that is not common, and it's an high risk one that the vaccine you took does not target. What then? So someone that is vaccinated can still get the disease. You get, it's just that the vaccine will prevent you from the common ones. So at least there's a high percentage there. You have there's a high percentage, but it's not 100%. So the fact that you take the vaccine does not mean that you should not screen. I hope you understand. So let's move to the next slide. Okay, so now what are the types of tests? If you come to a clinic now and say, I want to screen for cervical cancer, what are the types of tests that are available to do? So there's the HPV test, the pap smear, which is like really common. Everybody says pap smear, pap smear. Then you can do HPV and pap smear together. And then you can do VIA. VIA is visual inspection with acetic acid. So let's start with the HPV test. I feel like I need to catch my breath. Okay. Starting with the HPV test. The HPV test will check for infection of high-risk HPV types that can cause cervical cancer. Then the pap smear checks for changes caused by HPV. So the procedure of these two tests, HPV test and pap smear, they are very similar, but it is what they are checking that is different. So HPV test will check for infection. It will check if the person has actually been infected with the virus. That's what it's checking for. It's not checking whether there's a deep cancerous lesion, whether things are really changed. It just want to check, is there an infection? But a pap smear will check the cells for changes, abnormal changes that can be caused by the virus. So that's the difference between those two. So the pap smear is checking for changes that can eventually lead to cervical cancer, and it can find precancerous cells, and even if it has already led, even if the cancer has already formed, it will find it too. You understand? So like I said, the procedure is the same. So sometimes they can do it together. So the one that is different from these two is the VIA, the visual inspection with acetic acid. This one, there's no, you're not taking anything to lab, you're not using microscope, you're not doing anything. Sorry. For this VIA, you're not taking anything to lab, you're not doing anything. You're the nurse that is performing this test would um the nurse that is performing this test after cleaning your cervix and exposing it, she would apply she would dab 3 to 5% of acetic acid on the cervix. And after dabbing it, she'll wait for 1 minute. Well, and she's not using any special glasses. She's just using her eyes to check. So if there's abnormal cells, if there are abnormal changes in the cells, the part that she has dabbed with that acetic acid will turn white. It's called acetal white. It will turn opaque and turn white. So that would indicate that there's something wrong. So that's just visual inspection. This one is very accessible, very easy. This one you can do it in PHCs, you can do it in rural areas. You just expose the area, dab the cervix with 3 to 5% of acetic acid. You wait for 1 minute, you check with your eyes. So if there's any issue, you will see it to become white. That's visual inspection. So now let's talk about the procedure of the other two, HPV and pap smear. Thank you. This is the slide I need. So when you go to the clinic and you say you want to do pap smear or you want to do HPV test, what are they going to do? What is it like? Is it painful? Is it not painful? So this is the procedure. When you get into the procedure room, there'll be a couch. They'll ask you to lie down on the couch. You lie down on the couch and then you lift your legs up. It's the same position as the position you commonly see when people want to give birth. It's called the lithotomy position. So you'll be put in that position. They'll tell you to hang your leg. So you hang your leg, and then your laps will be separated to be open so that your vulva can be visible. So obviously you would have removed your underwear, everything. So the nurse would clean your vulva. So that's the first thing. So she would just take like Savlon in cotton wool and clean the vulva. Then afterwards, she would insert a speculum. So that's a speculum. The second level of the image to the left, that's a speculum. The image there is a speculum. So the speculum is just an instrument that is used to visualize this particular speculum. Is an instrument that is used to visualize the cervix. So they want to, it's not easy to see now. The vaginal too is not like, it's not like it is open like that. So they are going to use the speculum. They are going to insert the speculum and open it up so that they can visualize the cervix properly. So this part can be a little bit uncomfortable, but it's not as if it's painful. You get. So the next step is that she's going to take a long, it's like a brush, it's a very small brush. It's like, it looks like a cotton swab, the one used for your ears, to clean your ears. That's what it looks like. So she's going to take that cotton, like is a brush, a cytology brush. So it's a very tiny brush, it's not scary. So she's going to insert the brush into the speculum, into the cervix. Now we've said earlier that the cervix is like a circle. So she's going to take that brush. I'm going to use the brush. She's just going to like go around the circle in clockwise motions about 5 times. It's not like a lengthy procedure. She just once she opens it up, she just go in 1, 2, 3, 4, 5. That's all. That's all. That's the entire thing. Then she'll remove it and she'll put it inside the container and she will label it. That container will be sent to the lab. So in the lab, they will check using a microscope to check. So what the brush is doing, the brush is scraping the cells of the cervix. That's just what it is. But it's not as if like it's scraping and it's painful. It's not a painful procedure. It's also not a lengthy procedure. It takes like 3 minutes. It's not a lengthy procedure at all. So that's the procedure. Whether it is for so now the sample they've taken now they can now use it for HPV test or pap smear. But that's the procedure for both of them. So as we have seen in the second image now, it's just looking like a cotton swab. So they just use that thing, they just go around and then they will take it to the lab. So that's the procedure for cervical screening for HPV test. I've also explained the procedure for visual inspection. So we can move to the next slide. I'm actually done. I'm done already. So this is the last slide. So this webinar is literally just to expose you to the disease. What is it like? What causes it? How can I protect myself? How can I modify my risk factors? So that's what we've been discussing. So cervical cancer is very common. It's the second most frequent cancer that affects women in Nigeria, second to breast cancer. But this one, it is preventable and it is treatable. So like there's really no like why should somebody still have it if it is preventable and treatable? Do you get? So now we've been discussing the causes, the mode of transmission, the the methods of prevention, right? So it is very important for somebody to get screened early. It's very important for you to get vaccinated. It is free. It is so important to the government and even on a global scale that is offered for free. It's offered for free in primary healthcare centers. There's nothing that is stopping you from getting the vaccine. Whether you can say, okay, I'm not 14, you can still get it. I'm already having sex, you can still get it. There's nothing that is stopping you. Then also going for screening 5 to 10 years from age 30. And if you are someone that is living with HIV, you can start screening from age 25. So people even start screening earlier regardless. So I know a friend that she had got a pap smear like a couple of weeks ago and she's in her 20s. So it is treatable and it's treatable as long as it's caught early. So we want to make sure that we are screening early. So God forbid, but if there is a problem, so we can treat it. It's completely curable if it is found early. So screening is important to find cervical cancer before it spreads when it is easier to treat. So that's the end of my presentation. I hope that I was like you can understand what I was saying, and I hope that you gained something. Thank you very very much for listening. Thank you. Can go to the last slide now. I'm done. Thank you very much.
Thank you so much, Nurse Akoni, for that great time. I'm so happy to have you here. And I know that people that are watching us now and people that will still follow up later on will definitely get a lot from this webinar. And the fact that I even learned quite a number of things from this webinar shows how intentional you were about putting up these things together, putting these lives together. You definitely knew your onions and you knew that you were coming to deliver and you delivered. So I want all of us to say thank you, Akoni. If you can see me this evening, please let's say our thank you in the chat box to Nurse Akoni. Thank you so much for listening. Few of the points that really stood out to me, I have been able to share them in the chat box. So you can also follow up on that. And we might also have our slides on our Instagram page, um, rather, I mean, the side notes that we had this evening, we'll have them on our Instagram page. And if you are yet to join our community, the the material itself, the slide itself, has been has been sent to our community page. Thank you all so much for joining tonight. So this is our major take home. Cervical cancer can be cured if diagnosed early. This means that if you're 25 years, you can go to the clinic and just say, "Oh, I want to do screening for HPV," or just say, "I want to do screening for cervical cancer," whichever of the methods that Nurse Akoni has mentioned tonight would be used for you, and you'll be able to know your status. The first step to flattening the curve of cervical cancer is early diagnosis. So when we know the status, we know, oh, I don't have anything like HPV strain or anything that can cause that particular one that can cause cervical cancer. That is your own way of helping the world flatten the curve. So thank you so much. I want you to share that video. Maybe you at any point you can watch it, you can go back and check it. That's why we're using this app so that I'll be able to follow back. So please, you can just check back. You can also share it with your colleagues, friends. This is a very great gift to give them. Thank you all so much for joining. So, okay. I forgot that we are going to have a question and answer session. So, Deborah Matthews said that is there any test for someone that doesn't know if she took the vaccine between 9 to 14 years or is just safe to retake it probably after doing the pap smear? Mr. Connie, I don't know if you can see the question, or I should repeat myself.
Please let me hear again. What did you say?
Okay, she says that she said that rather, Deborah said, is there any test for someone that doesn't know if she took the vaccine between 9 to 14 years or it's just safe to retake it probably after doing the pap smear? What she's trying to say is that when she was 9 or around 9 to 14,
Yeah, you don't
but
know.
she's
You are
still
not
a
sure.
small person. She's
Yeah.
not sure if it's okay, maybe at home or they used to give us plenty immunization in school. Maybe that was also part of the um injections that she took or immunization that she took. That can she just take it again or she should do the pap smear, then she'll know her status and then take the vaccine.
Okay, so I'm going to say like what I know. But I know that the HPV vaccine was recently added to Nigeria's immunization
To
schedule. So,
um,
like, the way it is that
Nigeria.
like there's a schedule for children.
Mhm.
The HPV vaccine has been recently added to it. So, if you have a junior sister that is 9 to 14, chances are that it will be part of the routine vaccinations that they will take. But it is that so for someone like us now that even myself, I'm not sure. I'm not sure if we took it or not. I'm not certain. Like I'm not confident that we did actually, which is why I personally we took it just in case you don't know. But for someone that is much older, I don't know the age of the person that asked this question. For someone that is much older, you can definitely like if you're above 26, like I think it's a good place to start from is the screening. So you can go to the clinic and get the pap smear or VIE done to know your status. But if you are younger than 26, from where I'm standing, oh, like it seems like a good idea to just stick it since you're not sure. Or if there's a way that you can, request your forms and your cards from your parents, you can definitely check, right? But if you're older than 26, like you can start from the screening. So that's what I will have to say about that.
Okay. Thank you, Ms. Tony. And from what I was able to check up I was able to check up that the vaccine was added on October 23rd, 24th rather, 2024. So it's just a year last year. So no way you would have like taken that. We
Exactly.
don't know
So
how old you are currently, but we guess that you are not 14 or 15, so you can still like take it if you are not sexually active. And if you are sexually active, you can still take it. But please, we want you to also know your status by checking at the hospital for the pap smear or VIE as she has mentioned. So it was introduced as routine vaccination. Let me repeat myself. Routine vaccination. That means that it is part of, oh, we'll give you maybe at home or in your school or anything. It was just last year. So I know that if you were given last year, you remember that at least they gave you something last year
yeah,
and it's cervical cancer. So I think it's best you just take it again, and if you can like do the screening also, it will be great to be screened then take the vaccine. So we don't know if we're able to answer your question, Deborah Matthew. If not, you can still send me the question or your concerns at your favorite nurse one at gmail.com. So thank you so much for joining tonight. It is a great pleasure to host Nurse Akonitomi and every one of you. I can see you. I can see Famduro Jaye. I can see Miss or Mrs. Deborah. I can see Similolu. I can see amazing people that did not comment tonight. They are joining from wherever in Nigeria or even outside Nigeria. Thank you so much for supporting us. Thank you so much for always checking up on us on YouTube, on every of our social media handles. So next month again, we'll bring in another season um, teacher, another seasoned healthcare professional on your screen. Thank you so much. I remain Madam Florida Mutsorayo, lead team favorite nurse. Thank you so much and have a wonderful night rest. Bye.
night.